Now, according to Nigeria's Coordinating Minister of Health and Social Welfare, Ali Patte, and the Minister of State, Dr. Tunji Alausa, the health sector is set to be guided by 4 key-point agenda. Now, they mentioned the improvement of the quality of governance and leadership of hospitals. The second agenda was the improvement of population health outcomes so that diseases like diphtheria, measles, vaccine-preventable diseases, and maternal and child health would also be focused on. Third on the list was medical industrialization, and fourth was health security, where he said that the aim was to ensure that when diseases broke out, epidemics occurred, Nigeria would be prepared and able to effectively respond to these outbreaks, pandemics, and humanitarian crises. Well, joining us on VSA today to discuss these issues are, first we have Dr. Otefe Edebi, a medical director, Gracehill Place Hospital in Lagos, Nigeria. Thank you so much, Dr. Otefe, for joining us.
Thank you for having me on the show.
It's a pleasure. Thank you. All right. We also have Dr. Roland Aigbovo, Vice President, West Africa Region, Commonwealth Medical Association and Chairman of the Nigerian Medical Association National Committee on World Medical Association Liaison, Abuja. Thank you so much, Dr. Roland, for joining us.
Thank you for having me.
It's always a pleasure. Thank you, gentlemen. Now, we're talking about the 4-point agenda in the health sector. And according to Dr. Ali Patte, one of the things he mentioned was strengthening health-related institutions like NAFDAC, especially to regulate the quality of food and also the quality of drugs. He also touched on the issue of mass exodus of qualified doctors, where he said that more funding needs to be pumped into that sector to improve the quality of what they produced. Now, that brings me to my question. I would like us to, first of all, evaluate what the health sector was before the ministerial appointment. On a scale of 1 to 10, how would you have rated the health sector before now? Let's start with you, Dr. Otefe.
Well, to rate the health sector, we have to look at certain indices. So we can't just give an overall figure or an overall value. However, those of us in the healthcare industry will agree that currently the healthcare sector in general is not in a very good place. And I kind of like the agenda of the new government, which is renewing hope in the health sector, because currently it's a field of it's a sector in Nigeria that is in serious trouble, and people are losing confidence and hope in this particular area.
All right, Dr. Roland, now introducing these reforms is something that we have been singing about for the longest time. So what's to say that proper actions will be taken this time around?
Well, a whole lot have been said about improvement of the health sector, and have a whole lot of policies, a whole lot of agenda to improve the healthcare sector. But over the years, we've found out that there's actually no political will to make that happen, because our previous ministers of health before the current one, Ali Patte, have actually also had an agenda on how to improve the healthcare sector. But for me, I think it's just nosediving on a daily basis into a pit that if care is not taken, you might not be able to get out of it. So the whole idea is actually not coming up with an agenda or coming up with reforms or renewed hope. Is the political will. Government needs to prioritize health. Not until that is done, no amount of effort or no amount of agenda and all of that is going to take us out of this quagmire, really. That political will has been lacking. I just hope and pray that we have that political will this time around to actually make things happen.
All right, thank you for that, Dr. Roland. Now, Dr. Otefe, for the first time, 8% of the country's total budget will be allocated to the health sector, as opposed to 5% in the previous years. Is the budgetary allocation one of the reasons why we're far behind on health?
Definitely. The funding that healthcare has received until now has been a large part of the challenge we have had. And even though it is now 8%, WHO still recommends even much higher than that. But I would say that the fact that we are having an increment in the percentage of the budget and increment is also a demonstration of the will of the present government. So I would want to see it in that regard. So it's a fantastic thing, it's a welcome thing, and it's something we're excited about.
All right, Dr. Roland, now part of the agenda is health security. Nigeria will be prepared and able to effectively respond to the outbreaks, pandemics, and humanitarian crises, according to Dr. Ali Patte. And that brings us to what happened during the COVID-19 period. If we weren't well equipped and well prepared, in your own opinion and from your own professional eyes, how exactly did we scale through the COVID-19?
Well, the success that was made during the COVID-19 pandemic actually had to do with, will I say, multifactorial approach. Multifactorial in the sense that a whole lot of it was something that that brought the whole world to a standstill. And it's not matter of some persons are spared and some are not spared and all. Everybody now were now involved. Everybody was scared of the pandemic. So the success we were able to achieve was because of one, the enlightenment was there on how people should now live the new way to live now, rather than social distancing and all of those precautions to be taken, and then also the issue of indigenous production of some of the ventilators and all of those to make do to actually assist in the ventilators that were actually not available, because a whole lot of inventions came into the local production to actually assist in those that actually need ventilators. And apart from that, I believe strongly, until proven otherwise, that our weather actually also played a role for us, unlike what we saw in the other third world countries that are temperate regions, you understand? Because I didn't actually see anything spectacular that we did, whether in Nigeria or even the whole of Africa, that actually have made the result different. Because even from the little time that we experienced, we saw the surge during the rainy seasons, and then it declined towards the dry season and all of that. So, but by and large, everything put together, the government actually came up, they were forthcoming with all the assistance given to in hospitals, and then the healthcare workers, and the incentives to motivate them. And also people actually took ownership of the whole process, because if you don't take ownership of a process, that process is bound to fail. So the fact that, if you don't do what you're supposed to do, you are bound to get this disease. And once you get this disease, you are bound to die. And of course, every Nigerian wants to live, and people are scared of their life. And many people also lost their loved one. Though many people still also believe that COVID was a scam, because even the government at the time, they actually were doing things that make people to also believe that they were not doing the right thing. So the success that was gathering was multifactorial. Governments were there to assist and provide the basic things. Then the people also took ownership of the whole process, and then the precautions, and all of them communicated to the
Okay, Dr. Roland, I'm glad that you mentioned, I'm glad you talked about indigenous production, because, I was going to go there next. Dr. Ali Patte mentioned that Nigeria will now be producing its own medicine and vaccines as well. How feasible is that?
Well, it's feasible. It's feasible, really, because as at 2021, the Nigerian Medical Association actually were pushing for the indigenous production of both drugs and vaccines and all. And then there's these institutes in, I think, Jos, that actually have been moribund, involved in the production of vaccines that are supposed to be rehabilitated, which up to this moment, I don't think is functional. So we have the manpower, we have the human resources, but I believe strongly that we lack the infrastructure to actually sustain that. Because it's not all about coming to say that we have to produce this, we need to produce that, and all of that. Do we have the infrastructure? We're talking about infrastructure, we're talking about the physical structure, we're talking about electricity, we're talking about water, we're talking about even the local content, the raw materials to produce that stuff. Even if the raw materials are available, what about the power? Of course, you know that power in our country is almost abysmal, if I may use that word. So if every of these things is put into perspective, it can be done. But like I mentioned earlier, we need that political will to say that this has to be done. And once that is put forward, every other thing will fall into shape.
Okay, now let's say that we can make that happen, produce our own products and medical products, manufacture our own vaccines and all that. Dr. Otefe, what do you think will be the benefits of having to manufacture our own products without having to export, and buy things from outside the country?
Without having to import these things. I mean, the benefits there are a lot of benefits we can derive from that. Like Dr. Aigbovo mentioned, as long as there's the willpower, as long as the infrastructures are there, these are not things that are alien to the Nigerian community presently. We are already producing medications here with increased funding, with creating the atmosphere that allows for this to thrive. Nigerians will do much more. It will create jobs for Nigerians. It would also allow for ready for availability of these medications. One of the challenges we have today is because people pay out of pocket. The cost of healthcare is quite high. And if you have to import things with the current exchange rates, you can imagine what medications will be going for. But if we begin to produce these things indigenously, then it will also reflect in terms of the cost of purchase. And this generally will make healthcare more accessible to everyone. So it makes healthcare more accessible. The whole concept of the agenda, 4-point agenda, is medical industrialization, which brings the economic aspect, increases the economic aspect of healthcare, because we will not only be producing, hopefully, not only first be producing for our own community, but hopefully we'll also be able to export some of these things to maybe neighboring African countries and even beyond.
All right, Dr. Roland, let's touch a little on the issue of brain drain. Now, we know that there's so many doctors in the country who are willing to go outside the country. And we also hear that there are doctors outside the country that are actually willing to come back to the country, that if the economy is better for them. How do you think this can be made possible with this new administration? Do you think that if all these things are put in place, then we would no longer have to lose our own doctors, and even some of them over there would want to come back?
Right. When you talk about brain drain, is a two-way traffic. I always tell that there is a pull and the push factor. But as it is today, we have the push factor now is actually more than the pull factor. The push factor now is that those are the things that actually is taking doctors out of the country, or not just doctors, healthcare workers out of the country to seek both greener pastures and then expertise and all of that outside of the country. And with the current economic situation of the country, insecurity and all whatnot, many doctors, according to the Medical and Dental Council registration, we are supposed to have over 80,000 doctors. Believe you me, we have less than 30,000 practicing in Nigeria at the moment. And even the less than 30,000 that are here, it's quite a number into administration. Others are not even practicing, and there's supposed to be a ratio of one doctor to 600 patients. But as it is in Nigeria today, it's about one doctor to almost 10,000 patients. Why is this happening? Because doctors are moving out of the country. Many that have left the country, not actually because of remuneration or better life and all of that, it's actually to seek for more knowledge. Now, after you sought for this knowledge, coming back to the country, do you have those infrastructures, those equipments to work with? I know of many doctors who traveled out of this country for super specialization, and they came back, many of them came back, bought their equipment to Nigeria to practice with. But unfortunately, patient cannot even afford to pay for that, because the fact that he bought his equipment, he had to maintain the equipment. So if you keep running charity and all of that, the equipment breaks down, then it's gone. So patient cannot even, just like what Dr. Edebi said, this high out-of-pocket expenses or out-of-pocket procurement of health is another tale that is actually killing the health system. So this can be, well, for doctors to come back, it's much more easier to entice doctors to come back to the country and improve the healthcare system than preventing doctors from moving out of the country. Because every doctor that, if you graduate 100 doctors today, more than 80 are already preparing to leave the country because they feel that they don't see any bright future practicing in the country, and we won't blame them. But many that have gone and out of the country that have gotten super specialization want to come back and assist. I know of also some doctors who have trained outside of the country and they are back to the country, putting that expertise to use and to improve the health system. So it's hard to be well, I don't want to be a prophet of doom, but if you ask me now to give a straight answer, it will be very, very difficult to stop doctors from moving out of the country. Well, maybe you can entice some of them that have moved out to actually come back and practice if there is an enabling environment.
Well, I think I'm going to say that we're hoping that our pull factor is greater than the push factor going forward. But Dr. Otefe, let's talk a little about private investment. We know that the weight, especially of the health sector, might be a little too much for the government alone to handle. But at the same time, the government needs to weigh in on the private sector, talk about funding, financial assistance and all. Would it be feasible if these two sectors can work hand in hand? Because, I mean, looking at the ratio of hospitals and doctors we have, just like Dr. Roland said, it will be very difficult to just stick to the government-owned health facilities alone. What do you say about that?
Well, fantastic question. The truth is this, the challenges we have in the healthcare sector here in Nigeria is not peculiar to us. And many nations and many countries have um, they've woken up to take on these challenges. And one of the things that make for effective delivery of healthcare in a nation is the public-private partnership. If we have to make it work, we definitely need to look into that aspect. And one of the things that makes for effective private delivery of healthcare service is funding or some form of subsidy that the private sectors can get. It could be incentives, it could be subsidies, it could be incentive, things that allows the private sector to thrive in delivering of healthcare to the population. So you could have a system where you have a private facility that covers a certain area, and then you have the data of the people there, and then the government subsidizes or provides certain kind of incentives. There are some incentives currently, but they are abysmal. They are not effective enough to allow the private sector flourish. So if these things are put into place and we have more fundings and more investments in that area, I believe so strongly. It's not a quick fix. We have a serious problem in the healthcare. So we don't expect a quick turnaround. But if we start on a pathway of recovery, it may take a while, but we will definitely get there.
All right. The minister also mentioned that changing the narrative depends not just on the government, but also on citizens and individuals generally. How is that, Dr. Roland?
Well, it's possible if only the people are meant to be part of the process. But now, I believe strongly that the narrative of the healthcare system in Nigeria cannot improve if we don't pay attention to the primary healthcare system, because that is the closest health facility to the people, even in the rural, of course, in the rural areas. If the primary health care, which is the first port of call when you talk about healthcare system, is almost non-existent. It's not functional. Believe you me, nothing that will be done in the health sector will make any impact. Because one, all of this 4-point agenda that the coordinating minister have mentioned, I don't believe there's anyone that is particularly targeted at reviving the primary healthcare sector. No, now if the primary healthcare sector is functional, that is where the people can actually get involved to the issue of ownership. You know, if you believe that this thing that is being done will favor you, you actually want to do everything to protect that particular thing. For instance, there are some public-spirited individuals that will build hospitals and build facilities all over the places and all of that. If they don't involve the people will be the one to protect those infrastructures. Many a times, the people will encourage the workers that come there, the healthcare workers that come there, to keep that place alive. So if that ownership is not there, yes, I believe 100% with him that the people have to get involved. It's not government alone. And just like what Dr. Edebi also said, the private sector will also have to come in. Just a little bit of digression, just to add to what Dr. Edebi has said, government will also be seen supporting the private sector. For instance, where you have the issue of multiple taxation to private institutions providing healthcare. So we are killing the system, because at the end of the day, the end users will be the one that will actually pay for those services, and therefore increasing the cost of provision of procurement of healthcare. So the communities, governments, associations, every part of us need to get involved to be able to make this happen. Thank you.
All right, Dr. Otefe, I would also like to ask, now, when we're talking about making more effort to spotlight the health sector, are we talking about it generically, or are there different or some systems or aspects of the health sector that need to be spotlighted on its own? For example, midwifery and some other sectors that have not been pronounced over the years. Isn't that where the real change will come from?
Well, the thing is that it has to be faced. Every aspect is important. And so we will have to definitely focus on the primary health care sector. And that's where you have the things like the midwifery and all of that, and those aspects that deal with maternal health and child. You know, those are aspects that for the longest years has been focused on and still has to be focused on. So it has to be faced. So we will focus on that. But when we talk about healthcare, we need to look at it holistically. And that's hopefully what this government and subsequent governments should focus on going forward, not just only one aspect, but like we're talking about medical industrialization now, we need to focus on that. We need to focus on regulations, which is what we're talking about, health outcomes and governance, which is the first agenda. So all those areas need to be focused on, and we need to also have them played out in terms of stages, what needs to be addressed immediately and what needs to be addressed in the long term.
All right. Just like we mentioned earlier, there are doctors abroad willing to come home, but at the same time, there are a lot of them in the country that are willing to leave, all because of the system, put in place. And it's our hope that, like I said, and like Dr. Roland also said, that the pull factor becomes greater than the push factor. And the minister has also said that the reunification of everyone's involvement is what is needed to gain ground. I want to say a big thank you to Dr. Otefe Edebi, a medical director, Gracehill Place Hospital, Lagos, Nigeria, and also a big thank you to Dr. Roland Aigbovo, Vice President, West Africa Region, Commonwealth Medical Association and Chairman of the Nigerian Medical Association, National Committee on World Medical Association Liaison, Abuja. Thank you so much, gentlemen, for joining me on the show.
Thank you.
Thank you for having me.
It's a pleasure. You're still watching Village Square Africa. We go on a short break now, and when we come back, we look at the devastating effect of the Morocco earthquake. Do stay with us.